So I'm Dr. Maria Panourgia. I am a consultant geriatrician and I'm working in Milton Keynes University Hospital. It's not that most of the patients don't have experience on the incontinence pads, because many of these patients have had children. They have used them when their children were very young and they were incontinent at that point of their life. When we were using, at least me as a mom, a urinary pad for my children, I was trying to make sure that it was comfortable, that it was not very bulky, that it was good absorbable potential, so it was not leaving the skin moisturized and very damp. And they were allowing my child to be able to move. So I would say the same things for the patients, because it does not change very much. You need to promote comfort. If the patient is able to walk, it is better maybe pull-ups, because they are more easy to use, they are more natural of how we use our underwear. Maybe people that are more bedridden or with different mobility and they are more dependent on caregivers, so something that it is more easy to access and to put on. But definitely they need to snug the patient, to embrace, if you wish, but they shouldn't be bulky, because we are risking that they create pressure areas and pressure damage into the tissues. Of course, we need a product that allows to absorb the moisture and the urine. It does not allow to go back, so to absorb and to keep it absorbed in the pad. And the layer of the pad that it is close to the skin, to be skin friendly, so to be hypoallergic and to be able to make the skin breathe. If the skin breathes, then a part of the air that is more comfortable for everybody, it reduces the temperature. And the temperature, we know that helps bacteria growth, so we don't really want that. It is the way that they are functioning, the difference between the two products. The menstrual product is made to absorb the thicker blood. And sometimes women, we know that we will also have, especially in the beginning of our menstruation, clots or things that they are quite dense. Urine has a different density, it's of course very liquid. So first of all is the potential of absorption that the product has. Secondly, these products, and we know very well, they are not working as pads, so they are not necessarily able to absorb the quantity of urine. It might lead to leakage and to odors. Also, the skin, the urine, tends to have a pH that it is higher. It is less acid in comparison to our skin. Menstrual pads, they do not work in the same way, meaning that the layer that is closer to the skin, it does not have a specific pH thought to absorb what happens with the urine. So the urinary pads, the special urinary pads, are made in the layer that it is closer, the underlayer that is closer to the skin. It is made with a pH that makes it absorb the urine and respect the pH of our skin. We need to remember our skin is a living body, like it's a living system, and we need to take care of it. 36% of the women are using menstrual pads. Probably it is the stigma, the shame on going to the supermarket and buying urinary pads. It can create some discomfort and some embarrassment, so probably it is easier to go to that other. The second is about the fact that they cost probably less. They're more affordable, so we need to think about the economy. But in the longer term, on that point, because they can create, because of the reason I said, dermatitis, to treat then a skin infection, a dermatitis, a discomfort at the end of the day probably will cost more. We should, as health professionals, promote the use of the urinary pads for the woman. So to maintain the skin integrity is an everyday and more moments of the day task for people with urinary incontinence, because the skin can have damage like due to the humidity, so it can macerate. It can have irritation due to the products like the urinary pads or unfortunately the menstrual pads that can give skin dermatitis, urinary incontinence related dermatitis that can create itchiness, redness, a general discomfort. And also they grow because of the damp of the humidity and of the increased temperature. They can grow bacteria, so bacterial infections that are more difficult to treat, and fungal infection. All this to say that if we protect the skin, we prevent all these consequences that I told you. So it is very important to use creams, specifically that they can create, like zinc oxide creams, for example, that can create a barrier. And this barrier makes the skin impermeable to humidity, makes the skin protected from all these things that I told you, and makes the skin more healthy, like maintaining the balance. Also, it is good to use moisturized creams to keep the skin well moisturized. It's easier to prevent all these issues. For patients and the caregiver, I would say they need to change the pad very often. They need to change the pad, if possible, every time that the pad is wet. Now, it can be very challenging with patients with dementia, for example, patients in a care setting, in a hospital setting as well, but in a long-term care setting. So the caregivers need to be extra cautious and attentive when the patients are fulfill the potential of the pad to remove it. They need to use the right product. The urinary pads have super absorbent material, and this super absorbent material practically creates a gel, and this gel remains inside the pad, and it is super absorbent, not only because it absorbs everything, but also because if you squeeze it, it would not leak the liquid out, so keeps it there. So the right material, frequent changes, put the barrier creams, moisturize the skin every time you change the patient or you change yourself. And then we should, care professionals, caregivers, and the patient themselves, check for irritation. Now, the patients will be difficult to check the irritation, but if they find that there is a zone where they don't feel comfortable, then, as well as if the carer finds erythema, a red area, or something that the patient, if they have dementia, keep on touching around there, then to check if there is dermatitis. And if there are patients that they are prone, they have ultra-sensitive skin, they should check more regularly their skin. The other thing is we need to use hypoallergenic products. We need to keep the area very clean. So every time that the pad is changed, of course, we need to clean the area. And we need to clean it with odor-free products, hypoallergic. And we cannot friction. When we dry the skin, we need to damp, but not like to pat the skin, but not to friction, because we can create damage on the first layer of the skin. I think it is a combination between awareness and stigma. I think it's around 47% that will relay this information to their doctor. They tend to speak more about these things, around 67%, I think, with their health professionals. It's something that is difficult to admit. First of all, to admit that they have urinary incontinence, if we are talking about people that they have a normal life, not the residents in a care home. And secondly, it is the whole sensitivity. It is a very sensitive area in an anatomic point of view and in a social point of view, to admit that there is an issue around this place. To start the conversation, to make them realize that it is something normal. As I was saying in the example of the children, my son developed a pad incontinence and dermatitis, and I treated with massive amount of zinc. it should be as natural as. Urinary incontinence is something that happens with the age, can happen to women and to men, especially women, is more frequent because of the natural birth and the damage that this can give to the pelvic floor. So if we naturalize the issue and we make that something that is normal to discuss, then the patients will feel more at ease to come for advice. I think a part of the conversation and make sure that they use the right products and they are aware of the skin irritation. It will also reduce in the longer term, I think, the use of antibiotics, the use of antimycotics, because if the conversation is there and we are looking as doctors and healthcare professionals for the signs and we're asking for them, we will arrive a stage before the dermatitis become infected and we need to treat with something more serious. %80 of the caregivers, they are not educated on how to recognize dermatitis. Now, to classify a pressure ulcer, you can go on Google or on the words there are the pictures that they say this is grade 1, 2, 3, 4, and you have iconographic and pictures that guide you. We need to create this kind of possibility for the caregivers. So they have some material where they can go and say, oh, maybe this looks something that I can do, a little bit of zinc, and maybe treat it like that and be more careful and change more often and clean more often. But if it does not go away, or I need to raise it with the doctor, I need to see what is happening. So it is about educating, creating materials, short videos. If you have an irritation in the skin around that area, is terrible. You will not be able to go out if you are somebody that still has a social life. You will not be able to go out. You will not be able to do the normal things that you do with your friends, with going shopping, etc. If you are a care resident and you have dementia, you might, because of the irritation, develop delirium. You might develop more severe infections. So having the caregivers educated, again, as I was saying with the antibiotics, can actually reduce the costs on the health care of these patients. I really don't think they don't know. We all have children or grandchildren, more or less, most of the people. I think they do not connect the two. Because of the stigma, they do not speak a lot, so they fight the battle alone. As health professionals, to raise the awareness, to give the material, to let them, leaflets, in the clinic, etc., discuss with them. As I said before, to make it that it's a natural thing. It happens. You might be a very clever person and have urinary incontinence, and you may be very productive for your work, and you need to have a urinary incontinence. That doesn't mean anything. It's a condition. The loneliness that it comes, the depression that it comes, there are people that they have urinary incontinence is not a direct correlation with old age. There are people in productive age that they have urinary incontinence and dermatitis that they can develop if the skin is super sensitive, and whatever you do at them, maybe you will develop it. Imagine of the work day people are losing. And it is not about work as financial, but work does give us also satisfaction, isn't it? It's very sad to be at that point as a society. And I think that we have accepted many other things as natural. We're talking with no problem about neurodiversity. We should talk with no problem, with not stigmatize for urinary incontinence. It's a condition, it happens. And there are treatments. Again, talk about the problem. Campaigning. It's a pity. We do have as medicine, and we are working in more solutions that are not only pharmacological solutions. And it is a pity to not discuss about this The health professionals, they need to investigate this. In the comprehensive geriatric assessment in my profession, we ask about urinary incontinence, and we should ask. I'm not saying that we should ask when the patient comes to ED. Of course, they have more important problems. I think it is important to discuss it and to tell them, do you know that there are solutions? Are you using the right products? How can I help you? It's a difficult question to answer. I think they are affected differently. Even if women are suffering relatively more from urinary incontinence because of the natural birth damage of the pelvic floor, I think it is easier for women to discuss with their fellow women about that. Men is a little bit more difficult. It has to do with independence. It has to do that they feel that if they have something like that, they are not as independent and strong as they used to. There is a good percentage, I think it is around 50%, but somewhere there, that they do not speak, not even to their partners, about the fact that they have this problem. It is a very, again, sad situation. This loneliness, to go to war alone and to battle this battle alone, it is quite difficult and horrible in a way. And we should be able to support and ask them about this issue. Immediately, yesterday, if possible. Yeah, absolutely. It is generally the perineal area. This area is quite prone, even without urinary incontinence, because we are using now, trousers, and we don't allow a lot of air going around because, of course, we cannot, for obvious society reasons, we cannot go naked around. That's why it is important already, even to people without urinary incontinence. There is a lot in publicities, and there are a lot of products that are hypoallergenic, not odor-free, etc., to promote the hygiene of this area. Once you develop urinary incontinence, you need to be much more careful of your hygiene. You need to be more aware. You need to be able to do the 5 steps that I was telling you. Absolutely, yes. It is how to prevent. If you have the skin irritation, then you are in a different level. And when you have a skin irritation and you have changed the product and you have done the barrier cream and the moisturizer or whatever, you need then to call the professional. You need to ask the doctor to review, because maybe you need to treat with antibiotics or antifungals. You need a diagnosis at that point. And we are in the 3rd step, which is an infection.